So my presentation will focus on briefly on the health system responses globally to COVID-19, and then examine the reasons for poor performance. Then look at which countries have done well in relation to their response, and then look at some of the transitions in relation to digital innovations and transformations in health systems, and then briefly look at how one can create an ecosystem in Turkey or generally in other countries. So as of today, we have 52 million reported cases and 1.3 million deaths. Of course, these numbers are gross underestimates. The numbers are far larger than these around the world. But if you look at the epicenters of COVID-19, we see a very interesting picture because epicenters are Europe and North America and South America, and including Russia in Eurasia. And most of these countries are quite well off in terms of income. They have fairly well-established health systems, yet the response to COVID-19 has been very poor. And we knew that coronavirus was coming, but we were not prepared. But even countries that did try and prepare could not respond. So we have to ask some fundamental questions of why the response was ineffective, inefficient, inequitable, and inadequate. In fact, what COVID-19 has done is it has unmasked huge underperformance in health systems. We knew that health systems were underperforming, but what COVID-19 has done is shown us where the weaknesses exist and the magnitude of the weakness in health systems. The impact of COVID-19 is unprecedented. In April 2020, IMF estimated that the world GDP would shrink by 3%, with a 6% decline in advanced economies. But by June 2020, these revisions were upgraded to increase to almost 5% decline in global economy and 8% in advanced economies, and 3% in emerging markets and developing economies, where growth has been very strong and in spite of many challenges had reached double-digit figures. But that is no longer the case. But beyond the economic consequences, I think what is very concerning is the poverty, the social crisis that economic consequences will bring. So poverty, food insecurity, the broken social compact between citizens and countries, with demonstrations in many countries, Italy, United Kingdom, Spain, United States, and some Brazil, Chile. The name is very long. The numbers are many. And there are also changing attitudes to science, with strong polarized social polarization to those who believe in science and those who oppose science. So these are societal challenges that create problems for countries and the world as a whole. But some countries did respond fairly well. So for example, some countries such as New Zealand showed very strong leadership early on, but countries such as China, Singapore, and South Korea were able to apply policies very quickly, establish command chains, use digital technologies for effective communications to citizens, but they also use institutional memory from their experience with earlier SARS and H1N1 sort of flu epidemic. Germany was able to use budget flexibility to rapidly scale up diagnostics. Countries such as China, South Korea, Germany, and Sweden were able to use available resources in an optimal way. Sweden had a very interesting digital solution that enabled real-time reporting of capacity use, enabling optimization of system capacity. But very interestingly, we see for the first time use of integrated data and application of analytic capacity with tracking and tracing in Taiwan, in Singapore, and in South Korea, countries that have been very successful in the first wave. Taiwan is still doing very well in the second wave, although Singapore and Korea has had outbreaks. And in relation to health services, again, we see introduction of testing, remote care, telehealth care, and engagement of the private sector to optimize the assets, availability of the assets and their use in the system. And we're seeing, in terms of economic response, different shapes of response, a V-shaped response in some countries such as China, U-shaped response in others, perhaps and even a J-shaped, an inverse J-shaped, and in many W-shaped, with a first wave and a response and now a second wave. So these countries that perform well were those who were able to use digital solutions to mount an effective response. But the world has not been able to respond well to COVID-19 pandemic, and we have to ask the question, why this was the case. So if you look at the kind of interventions we use or we're using for COVID-19, especially in relation to behavioral interventions, they go back to medieval times, to Venice, the 14th century. Venice introduced quarantine, 40-day isolation of ships, hence the term quarantine, quarantina, which is 40 days, for ships that were arriving from the Silk Route. So this was very much related to economy and trade. But other interventions such as hand washing, social distancing, and face masks, again, go back to medieval times. But with face masks, we're still debating whether the use is effective or not effective, or which masks are most beneficial. So in my view, health systems and public health and science has really, I wouldn't say failed, but has really not performed well at all. And I think I'm being very generous and selective with my words. But the question is why? We've had pandemics. We knew that it was coming. WHO has been monitoring more than 1,000 outbreaks in the last 10 years. So why was the response so poor? Well, the reasons for performance, first of all, is what I call asymmetric innovation. It's a term I coined at a presentation I made at Collège de France a few years ago. So whereas we're seeing unprecedented delivery of innovations in new medicines, medical devices, health technologies, communication, innovation and delivery of these innovations into systems has really faltered. So whereas in relation to delivery of innovations, we have incredible renaissance in science and in delivery of technologies such as lab on a chip, big data analytics, artificial intelligence, machine learning, transition from public health or population health to precision medicine, innovation and delivery has not changed very much. So this picture is the oldest hospital in the world that is currently still functioning as a hospital, Hôtel Dieu de Paris. This was established in the 7th century, 651. Is still functioning as a hospital. So the systems have not changed, but the world has changed completely. But it's very sad to see that there are many countries still investing substantial amounts to build new hospitals, not thinking that the world has changed forever. And why is innovation and delivery important? Because if you look at health expenditures, and this is selected countries from OECD, Organization for Economic Cooperation and Development, of which Turkey is a member, expenditures on pharmaceuticals, medical non-durables, and other health technologies amount to around 15 to 25%. This is where the innovation is taking place. But the big part, the 75%, where huge inefficiencies lie, up to 50% of expenditures are wasted in some settings, is the health systems part, where innovation is not happening. That is because we have alignment of policy, misalignment of policies. On the one hand, we have industrial policies that encourage innovation, so delivery of innovations, great technologies. On the other hand, we have health policies that constrain innovation. As a result, many of the innovations that we see are fragmented, are not at scale, and they're not able to have population level impact. And this is a very important message to take away from today. Innovations are not happening at scale, highly fragmented, and many boutique cases. Very interesting, exciting, but they're not really being scaled up at countries or globally. And the third issue in relation to policy is that economic policies do not consider health systems as a dynamic sector for economic growth. Health sector is one of the largest sectors. It accounts for around 10% of world GDP, $10 trillion. But in many settings, in many countries see health as a social expenditure, but not as a driver of economic growth. I'm sure my colleagues from Koç and elsewhere will talk about the importance of involving private sector for economic growth in this. And the third reason for this underperformance is the institutional logic. We are really captured by broken systems that need fixing. And as Einstein said, insanity is doing the same thing over and over again, expecting different results. But we cannot solve our problems with the same thinking we used when we created them. So we need to move to a completely new trajectory to transform health systems. I'm not talking about incremental change or even leapfrogging on the same pathway. I'm talking about moving to a new trajectory that uses digitally enabled solutions to transition to a new health system, not a modification of the past that goes back centuries. So how do we do that? Well, I think COVID-19 has had huge health, economic, and social consequences, but it is also a major catalyst for transformation of health systems. As they say, never let a crisis go to waste. So this crisis should be used as an opportunity to really invest in innovation, to develop systems that are agile, so that can respond to external shocks, but that are also resilient for future, so that they are sustainable. So there are a number of transitions that will make this possible if policymakers invest in these policies. The first is digitization. So there's now the opportunity to combine genomic level data to cellular level data, organ systems, and individual level data with health system data, primary care, at home, community, hospitals, across the care continuum. And all of these data at the moment exist, but they exist in silos and they're not pulled together. But there's an opportunity to bring all of this together into an integrated big data set and introduce analytics, much of which can be automated for data processing, which then can be used to develop decision support systems. So risk profiling populations and using novel methods of stratification to identify different target groups. And very importantly, one can take this a stage further by application of artificial intelligence driven dynamic care that is constantly learning from its environment and from the healthcare delivery process and the outcomes achieved using and optimizing integrated care pathways, but very importantly, optimizing resources. Because as I said, 20 to 40% of health expenditures are wasted globally. And that is not just in low or middle income countries. This is also in high income countries. In the US, my colleagues at Harvard estimate that each year $1 trillion of expenditure is wasted. This is a huge waste year on year. So integration is critical. At the moment, we suffer from fragmentation of data and fragmented solutions. The second transition is personalization. Again, enabled by the availability of data and analytics. So we're now able to transition from interventions or medicines that are for populations, for example, antibiotics or vaccines, that benefit some individuals, do not benefit others, but actually may have side effects or even very adverse consequences for some. We cannot transition to precision health, targeting subpopulations where outcomes are better for a greater proportion, but also the side effects are less. But there's an opportunity to move towards highly personalized health at individual level, bringing together data on individuals and their environments. With this approach, benefits accrued are very high, side effects are low, and the adverse events that cause unintended consequences, such as death, are very, very low. So there's an opportunity. The technology is here, but we're not using it. The third transition is the way we think about what to procure and what to fund in health systems. Currently, the solution is very much based on a technology or a therapy, or a technology plus solutions, or paying for an episode of care, such as a surgical procedure, or paying for management of a single disease. But we have to transition to management of multiple disease bundles and population level health with multimodal solutions that brings together digitally enabled technology solutions, healthcare delivery processes, as well as new therapeutics and new diagnostics. This will help overcome the fragmentation that currently exists. The fourth transition is automation. And we've already seen that application of this in countries like Japan and China in response to COVID-19 pandemic, very rapid uptake of conversational agents, such as chatbots that are AI enabled, or conversational agents with AI, artificial intelligence capability, and increasing use of robots for delivering partly remote or hybrid care. And many of these solutions currently exist. The fifth transition, which has been accelerated by COVID-19, is remote diagnosis and care. And there are many countries that have used this and are using this currently. Of course, these technologies have been around for 30 years, but it took COVID to help us transition to new methods of delivery. And finally, the sixth transition, where major benefits will come, is what I call real-time health, using smartphone sensors that can monitor many physiological parameters, but also parameters in relation to one's activities or a condition or one's environment, and also intelligent wearables, smart watches, smart glasses, smart fabrics, as well as sensors that can be put on other parts of the body, onto skin, so on and so forth. So the focus here is health and predicting adverse events, as opposed to focusing on the current model of managing disease and rewarding complications. This is a major transition in managing and improving health real time, as opposed to waiting for consequences for a condition to be treated in hospital. Every hospital admission is a failure of the health system. We have to think about creating a health system. So how do we do that? Well, I think there's a real opportunity for Turkey to move towards what I call transformation, health transformation 2. I was privileged very much to evaluate the first health transformation program from 2003 to 2013 that had major achievements. There's now an opportunity to move Turkey to a completely new trajectory, not pursuing the trajectory of the past, but creating a new model or new models of healthcare delivery. Now you might ask, what did this look like? Well, actually, this is the exciting opportunity, because if you are serious about innovation, you have to create the frontier. So there are no off-the-shelf solutions for the future by definition, because we don't know what the future is, but we can shape the future. So herein lies the opportunity to develop this frontier and push the frontiers of innovation further. How can we do that? That needs an ecosystem. It needs to bring together, in a very serious way, in a systematic way, substantial investment in research at universities. All of this needs to be underpinned by great science. And then there needs to be collaboration, close collaboration with industry, not just pharmaceutical sector, but also medical devices, health technologies, communications, geographic information systems, behavioral science, so on and so forth, to develop research translate these into usable innovations. But very importantly, and we're very fortunate to have the Minister of Health here, we need to ensure that these innovations are applied and scaled up, because innovation implies use. Impact. We need to ensure that these innovations actually diffuse. So going forward, to transform transform health systems to harness possibilities, we need to invest in not buildings and bricks and mortar, as many countries do, but invest in people, invest in partnerships, invest in technology platforms and digital health, and develop policies that will incentivize research, development, innovation, and transformation. Thank you very much for your attention.